I believe that we need
I figure the more information we and researchers can get to, that we can look at and learn about, the more we can learn about thalassemia, the sooner we could find solutions.
My children do participate in the universal data collection, initially because I made them do it. But as they grew and came to understand the value of it, then now they know that it's good for them.
The overall mission of the Division of Blood Disorders is to promote and improve the health of persons with blood disorders.
What's really unique about the Division of Blood Disorders public health programs are that they're established primarily in clinical settings. These settings allow us to be able to work more directly with patients to identify what the problems are that they're having and to be able to work with them to develop interventions to improve their quality of life.
Epidemiology and surveillance is really the area of public health practice where we study and we monitor trends in diseases. We do this to understand the risk factors that either make people get sick or the interventions that help people get well.
People of all races and walks of life are at risk for deep vein thrombosis, also referred to as DVT, which is a clot in the deep veins of the legs. This potentially life-threatening condition needs to be monitored so that we can understand who's at most risk and what are the factors that go into that risk.
The CDC has done work regarding DVT and PE through a cooperative agreement with the National Alliance for Thrombosis and Thrombophilia. We also call it NAT. NAT has the opportunity to put on forums to teach people how to stop the clot, educate people about their signs and symptoms of DVT and PE, as well as educating healthcare providers across the country.
Some of the research that we're conducting involves blood safety issues, which is extremely important to the blood disorders community. And the research that we have involves collecting data, blood samples, so that we can test them in the lab for various viruses, both viruses that have been around for a long time and potentially maybe new viruses that might threaten the blood supply.
The role that we play in research in blood disorders is twofold. We're both a public health research laboratory, and also we act as a reference or a clinical laboratory for studies that are done by our division as well as our outside collaborators.
We do both research on basic aspects of blood disorders and how they occur, and applied research on how these basic findings can be put to use to improve clinical care.
Our division provides support in all aspects of data collection and data management for our collaborators. We provide data collection applications, we provide data management, quality control, analytic support, and education for how to use these tools to our collaborators.
In order to obtain the data that we need to monitor trends in disease, we have to partner with people who have access to that data. And so to do this, we partner usually with state health departments or academic treatment centers. We also partner with community-based organizations.
Prevention is the cornerstone of public health because it enables patients to take action to try to prevent disease and also prevent complications and prevent further progression of disease. The ultimate goal of our public health education programs is to help patients adopt behaviors that will better their health and also to prevent the risks that they can develop further complications.
We're interested in finding out the quality of life. We're interested in making sure that providers and patients and the general community have good information in terms of health education so that everyone knows a little bit more and has a better picture of what it means to live with sickle cell disease.
To build on our successes working with the hemophilia and hemophilia treatment centers, it's a model that has proven very effective. We would like to strengthen that model and continue to support it. We also like to expand to other people with other blood disorders like deep vein thrombosis and sickle cell disease and anemia and other non-malignant blood disorders. We also have other priorities. One of them is to promote blood disorders as a public health priority. My hope is that our division of blood disorders, within a few years, maybe 2 or 3 years, will be the leader in the world in the practice of public health to improve the health of people with blood disorders.